Hey class, well we're here in the final few days of the last week of the class. We've made it, and I just wanted to talk about a few things that were in this week's module, but I also kind of wanted to use this video as a way to wrap up the class and talk about some broader things that we've covered, and also give you some direction towards finishing some of the final pieces of the class, such as the final exam. So moving into the topic areas, we really this week you really cover a variety of different types of things. I kind of put a lot of special topics in working in addictions in this module. One of those topics is this concept of working with special populations in addictions, and that would include families too, but specifically working with the addicts. One of the trends that we're seeing in the treatment field of addictions is that treatment is becoming very specific to different types of populations. So I guess in that sense, we're looking at addictions, the field of addictions is being very responsive to this idea of multicultural and cultural differences and how that can impact treatment, meaning to be culturally sensitive to that, and culture meaning a wide variety of things. You read about gender-specific treatment in your module this week. Gender-specific treatment is, like I said, a real trend in addictions treatment, where they're actually separating out the males and the females in these treatment centers and providing very specific types of treatment approaches for females that are different than what they're giving the males. And most of the time, those treatment approaches really are addressing the very specific types of gender issues that may be going on that might be propelling or creating or enhancing the addiction. So things like trauma histories, specifically with females, sexual trauma histories, child abuse, and sexual abuse histories with both males and females. And those tend to be more effective when you're dealing with those in a gender-specific type of group, because there's not the type of posturing that might go on. If you've ever sat in a substance abuse group of mixed gender, you often see that it's very difficult for people to become genuine and authentic in those groups because they fear the way that they're going to be viewed by the other sex. So that idea of gender-specific treatment is very popular and has some research behind it, so it's something that we're moving towards. Also, you realized through the readings this week that geriatric populations are a highly increasing population in substance abuse treatment. You also see families highly involved in getting their elderly or aging parents or grandparents into treatment based on abuse of alcohol and prescription meds, those two being the biggest two. The prescription meds make sense because oftentimes older populations have to take increasingly larger amounts of prescription medications to deal with a lot of different medical problems, and I think that ends up to be problematic. I think that older populations also have some biological differences. They don't process drugs and alcohol as efficiently as younger people do, so that also increases the potential for addiction. And so we're seeing this high level or high amounts of traffic from older and geriatric populations coming in for the need for treatment. Families would be a big part of that component, because oftentimes those older patients, the identified patients who are older or in that geriatric population, really depend on family to get them to appointments, to get them to treatment, to sometimes financially support them through that. So working with families of geriatric populations are a very important thing. So those are very two specific areas that we looked at this week. You might want to go on and continue to learn about that by pulling research and looking at articles and that type of thing in those areas, because they are going to be a big deal. Also, what we talked about was credentialing in the area of substance abuse. A lot of students in our program are interested in going beyond just the school counseling or LPC license and getting some type of specialty license. And certainly substance abuse is one of those areas that I think makes people very marketable when they have a license to be able to practice addiction counseling. Now, one of the things that I think we need to be aware of is that if you move on to the LPC, that as long as you have specialized training training in substance abuse, and that you've beyond your graduate program, that you've gone out to workshops and conferences and really gotten additional training in substance abuse. With your LPC, you can treat substance abusers. You don't have to have this specialized license, but I think the specialized license shows that you have gone above and beyond, that you meet all the minimum competencies, have exceeded those competencies, and really have shown that you're an expert in that area of treatment. So now there are some insurance companies that do require that LCAS, that's Licensed Clinical Addiction Specialist in our state of North Carolina. That's the master's level license for substance abuse counseling. To have that license to be able to bill to those particular types of services, and that's some specific insurance companies that do that. That LCAS credential is very challenging to get. It's a 3-year process at least after, and this is postmasters, because you have to have 3 years of experience. You have to have the supervision from a CCS, which is a certified clinical supervisor. That's someone who has a specific type of supervisor credential to be able to supervise substance abuse counselors. So you have to find the CCS. You have to go through have the experience in a treatment center working specifically. Well, not just a treatment center, but at least working with substance abusers in some form, and get those hours and get that supervision. Pass the board exam. And there's a couple of other things besides the application and getting the references, things like that. So it is challenging. I'll be glad to talk to anybody who's interested in moving on and getting that LCAS. I can walk you through that process and get you on the right track for that. Also, we talked about professional associations. There's 2 professional associations that I wanted to talk about specifically, and they're linked in our Blackboard site. One is NADAC, that is the National Association of Drug and Alcohol Counselors. They do a lot of work around addiction and working with families of addicts as well, but also working with the addicts and working in the field of addictions counseling. That's the National Association that we have in the United States for addictions counselors. And then in North Carolina, we have APNC, which is Addictions Professionals of North Carolina. Now, Addictions Professionals of North Carolina, which I'm on the board of directors of currently, is the affiliate of NADAC, the state affiliate. So when you join NADAC, which is at this point is I think $130 to join, and I know that's a lot of money, but that's a year. What that's getting you for $130 is a membership in NADAC and in APNC. It's a dual membership for that fee, for that association fee. That gets you discounts at conferences and all the good things that come along with being a member, also getting you connected and networked with people that are in the addictions field. So consider joining these professional associations. We certainly want you to be a member of the American Counseling Association first and foremost, or ASCA for school counselors, or both. But then as you start to develop your interest in your specialty areas, you want to join the memberships that are associated, or the associations that are kind of affiliated with your specific interests. So the only other thing I wanted to say is that the DSM-5 is here, and that there are going to be some changes in the way that we look at substance abuse and making some treatment decisions and diagnostic decisions about where somebody's at in their substance use issue. DSM-5 has made some changes in that, and I certainly will be talking more about that if anybody is enrolled in the addictions class for the fall. But also, just to keep in mind that there's a lot of ways to get up to date on that. You can go on the website and just type in DSM-5, and it will bring up the DSM-5 website, and you can start to read about the changes they made in the substance abuse area. One other thing, I just put into our Blackboard site, I linked a link for a webinar series that American Counseling Association is putting on around the DSM-5. It's going to be 6 Wednesdays in a row, and if you can't make those particular Wednesdays at that particular time, when you do register, it gives you access to the recordings of those webinars, so you can at least go and watch them whenever you want by paying for that. I think it's fairly expensive. It's about $110 or $120 for the series, but it gives you 6 weeks, 6 hours of webinars around the changes that have come about with the DSM-5 and getting you up to date with that. So if you're interested in being part of that, you can go to that link that I put in our Blackboard site. Finally, I know that you're finishing up your discussion boards. So you're really being reflective about what you've gotten out of this class, how your attitudes and beliefs have changed about addictions and working with families in addictions. And so I want you to continue to post to the discussion board. But then certainly our last required component of the class will be the final exam. It is a comprehensive final exam, and it is a multiple choice exam. I just posted in our Blackboard site sort of the instructions and the practical issues related around taking the exam. So that will open up on Saturday at 6 a.m. and it will stay open until Monday at 6 a.m. It's open for 2 days, which gives you sort of a time frame within that 2-day period to decide when you want to go in and take the exam. But once you start the exam, you have to finish it. It's going to be a 2-hour time limit, and it is 50 multiple choice questions. And you know, I think it's really important that you to do well on that exam, that you've done a thorough reading of the textbook of each chapter. You should go back and make sure you've read that. You will not have time to really use the book to go through there and find every answer. So you really want to have a good handle on the information in the textbook. But also there's several questions from the family presentations that you guys completed, which I graded and put into the Blackboard, that you really want to make sure you go to the discussion board. And at the bottom there is there's all 5 family presentations. You want to make sure that you open up all of those PowerPoints and have them available, and that you've read through them, and that you've got a good handle on those presentations, because there's several questions in the final exam about that as well. And I think that don't want anyone really to stress out about the final exam. It's 50 points. It's 50 points of your grade, which is substantial. But I think everyone will do well as long as that you've put the time in to do the readings. I will say that all the readings and articles and the things that were in the modules aren't necessarily on the final exam, but having read those articles and having that background, I think will help you make informed decisions on the final exam. So that's kind of where we're at. So I'm glad that, just wanted to say I really enjoyed teaching the class. I'm going to be checking in on the discussion board for the next few days, and I'll be making sure that the final exam launches well this weekend. And if there's any technical problems with the final exam, make sure to email me, and we'll try to work through those. Make sure that when you take the final exam, that you take that using the Firefox browser or Google Chrome. Do not use Internet Explorer, and do not use Safari if you use a Mac, because they do just not work well on these tests with Blackboard. So try to use one of those preferred browsers if you can, and I think that should stop you from getting kicked out. I think if you have any issues and if you can't get up with me, you can always contact the help desk through the university. So once again, like I said, I've enjoyed teaching the class. Feel free to continue to contact me, email me through the summer if you have questions about things. We'll certainly get those answered for you, so thanks a lot.